morning, all. And it's very moving to be here. And personally, I dreamed for many years that I will be able to create such an organization, such a patient organization with NET. And during those years, it was very challenging to find someone who will take it upon himself together with the group and together with this group, with this very harsh group. And I'm very, very happy that during the last year and fourth, we are at least using your help. And we managed to create this organization with NET patients in Israel because it's impossible that we will live in Israel where we do have, we have an access to majority of the most advanced treatment, innovative treatments, various imaging methods, diagnosis, research, and we are at the cutting edge of this field, and there is no group of patients advocacy. The advocacy group is not important for me from the social aspect, not just for sharing and thinking how can we live with this disease, but as Theodore just said, it's very important to basically promote this research in the field, and in the end of the day, it's all for the benefit of the patients. And so thank you so much to all of you. It's very challenging. I know it's very difficult to be the patient and to arrive. To participate in those conferences, to be part, to be exposed to saying I am a patient, I have a disease, I have a chronic disease, I'm ill, so thank you so much. Thank you, Michael, he already mentioned, and of course for the medical companies, the pharmaceutical companies, without their help we wouldn't be able to organize such an activity, of course. And thank you again to all of them, all of my friends from the field of medicine, from additional centers. David emphasized that in Hadassah we are pioneers. We have quite a history there, and it's very important to emphasize that this field actually accelerated and is not just focused in Hadassah. We have other centers, so thank you to my colleagues from other hospitals, my friends from other hospitals, not just came here to talk and present to the patients, but they also cooperating on the everyday basis. And taking care of patients, treating that, and researching that, and promoting this field. And I hope I didn't forget those who deserve the words of thank you, but we have a little bit of a delay, so let's begin. I will talk a little bit about a certain condition, a very rare condition, in the rare conditions that we already discussed, which is a carcinoid tumor and a carcinoid syndrome, which is a very rare disease. And but before I will focus on this particular condition, I wanted just to try to organize a little bit some thoughts so you will understand what to talk about. Neuroendocrine tumors can secrete the surplus of hormones, and some of them do not. Majority of them neuroendocrine, they do not. There's no extra surplus secretion of hormones. 75% of those are tumors. Mostly they are non-functioning. They don't secrete those hormones. And of course, based on the name of the hormone, this is usually the name of the disease. So while secreting this disease, there is a carcinoid syndrome here, and you can also talk about that. The carcinoid, this is at 20% of those tumors. And of course, this is the main hormone that well known is serotonin, of course. Those growths can show up in different members, mostly in intestines, but it can also appear in lung, pancreas, ovaries, and etc. This is usually very difficult. level of serotonin are very high, and this situation can be very damaging to your heart, and it's called carcinoid heart disease. And of course, it's very life-endangering situation, and now our therapeutic approach should be to prevent that. And of course, all of those phenomena obviously can decrease the quality of life of the patient and to shorten the survival rate of the disease. And of course here you can see, and I'm emphasizing this whole topic of this cardio damage. Those patients that live with this usually metastatic cancerous disease also have cardiological damage, and we do not identify that in time. Basically, in fact, the survival rate is very low. There's a very short period of survival. We need to distinguish that, we need to understand that, we need to be aware of that. And as has been mentioned already a few times, we need a multidisciplinary team in order to be able to decide what one has to do and when. Because from one hand, we do have this metastatic disease, a lot of different phenomena of carcinoid syndrome, but from the other hand, we have also cardio damage that endangers significantly the life of the patient. So the first thing we need to do is, in fact, would be to provide this particular treatment in order to decrease the secretion of the hormone. And at the same time to decide when would be the right time to treat or to change the valves of the heart if they were damaged as a result of the disease. And in fact, usually those are the options of treatment under those circumstances. This is not the topic of my presentation for today, but just to show you that we have a few different lines of treatment in order to decrease the level of hormones and to stop the disease or to delay the disease. In fact, we take care of that. And of course, you decide whether there's a need of a surgery to substitute the valve. I will invite Professor Bruins. This is my presentation, and now we do. After Bruins' presentation, we'll have 10 minutes of questions about this particular disease. Each disease will receive a Q&A of its own. And of course, thank you for inviting me. And of course, Dr. Simona Glasberg and Professor Gross. And I learned something new. I'm almost 70 years old. And I have this disease from 2000. I didn't know of that. I live in the desert in the south, and that's why I choose this slide. But it's also actually related to my disease, because the first symptom that I detected of the disease, and I am having this redness in my face and this redness in my body, my whole body, there is this redness. So it began about 14 years ago. And I was brushing my teeth after lunch in Glasberg College. I lived there for 35 years already in the south. And I was brushing my teeth. And my wife said, "What happens?" And I'll ask others. It's very difficult to identify this disease. I was obviously treated by a physician, by a family physician. It was a wonderful physician, a great GP, really excellent one. But you know, a few things that happened. I had different scientific projects that I was participating. I flew from Tel Aviv to Kenya. I'm used to drink red wine, and I drank one glass of red wine on this flight to Kenya, and suddenly I didn't feel well. And I started pounding, my heart pounded, and I felt very, very bad. I'm on the plane, and what am I doing? That was the beginning. And there was a high pressure and diarrhea. And by the way, it's also developed. So from 2012, there was also an edema. First of all, there was a light edema, and my physician thought that it might be a result of a calcium blocker medication that I received in order to try to control my high blood pressure. So in 2000, I took students for different trips in the desert. I was still working, and I had like legs like an elephant, a very, very big edema. And I understood that something is very, very wrong with me. So my physician sent me for a series of echocardiography of my heart, and here it is finally. A tricuspidal valve of yours is not working anymore almost. And now we need to do something. One of my daughters, she's from Adass Karim, she's a midwife there, and she said, you know what, go to Professor Dangilon. While red fire, diarrhea, high blood pressure, and the heart valve is not okay. And he said, do echo heart again, and I will ask Professor Gross and Dr. Glasberg as well. What do I have? He told me that Katzer-Weiss syndrome. It wasn't really good news, of course, but I thought that's really a part of life because I need to go through the open heart surgery, and I'm very happy that he found it together with this amazing team that worked so hard. And so I've been treated by Dr. Simona Glasberg. And of course you can see those other treatments. This is a chromogram A, HIPAA browser, I think, and we also looked at the 5-HIAA. They were basically very high levels, apparently. Biopsy, and you do have this disease, really, and afterwards, after mapping of those tumors, and I had a few of those tumors, unfortunately, I received the initial first treatment with Simona gel. Are there representatives of Simona gel here, that med reps? Yes, really helped me. It really did. Day after the injection, diarrhea stopped and never returned. Well, besides, we all have diarrhea sometimes as a normal, regular people, but unfortunately that never returned. And then my condition really improved. I was healthy enough, one can say, to actually go through the heart surgery performed by Dr. Korach, and it was a very successful surgery, I think. It was very challenging, harsh surgery, because of my additional disease. And I was discharged in December, and in March of 2015, I heard from Dr. Glasberg that there is a new medication, telotristat. And since I'm receiving this medication, it's really easy. There are 2 pills with every meal, 3 times a day, so 6 pills a day. This is really very easy. I received that as a part of the clinical research in which I participate, and I began to swallow those pills. So the result was, as you can see, oh, this is not good. What's happening here? Okay. So in fact, you can see here, well, first of all, the chromograms decreased in general. It's still quite a high level relatively, so it's not completely down, but 5-HIA decreased significantly from 2075. Now it's in the norm. It's 8, 9, and that's as far as distant from Dr. Glasberg. This is a result of the new medication. It's actually certain things, of course, in my heart, I need to take different medications for my heart. We do have a little bit of time. I don't want to, kind of. What are the key issues I'm facing? So, well, there is a dramatic improvement in my health state because of someone with an autogel injections and open heart surgery and this new medication I'm receiving. And frankly, I can really perform quite okay. I'm actually functioning quite well. As I say, my grandchildren tell me, "Oh, your face is red." Yeah, it happens sometimes. So sometimes I don't feel that well. Really, I remember that I was at the scientific convention in Sweden. I went to the forest there, and I felt weakness, tremendous weakness. And it's probably related to medications. Maybe it was a decrease in glucose in my blood, so I ate something sweet and very quickly it improved my condition. So the few very simple steps. I always have dates in my bag, so I can snack on something sweet. And as Michael said in the beginning, I tried to eat a lot, and I gained weight. I'm quite okay on like weight scale actually, and I also developed in this field. There's well, I do have. I need to pay attention to all different systems of my body, but there is hope. There is hope for people with those diseases. With God's help, professionals, physicians, efficient medication will help us. Thank you for those who actually helped me. So a good Mediterranean nutrition, by the way, also helps. Sometimes I have the gallbladder stones, and by the way, Schlafstunde, which is a nap at noon.